Welcome everyone, and today we're going to bring you a session on case conferencing, how to proactively manage this piece of work in primary care. Yeah, well, we're going to start off with what's new, right? So the allied health components is what's new. We're going to look at the item numbers, compliance, who are your potential candidates, what does it mean to arrange and participate. We look at the workflows, the processes and the technology. That's a big chunk of the work. You know, as I said at the start, like people may know that this is around, but how can we make it systematized and really, make it hum for you as a new service provision? Right. You might have a residential aged care facility client that you think, well, I really need that allied's input. Well, now you can actually include them in the care and, obviously they can finally have some billing item numbers that they can claim to remunerate them for their quality time and input.
Let's have a quick look too at what those item numbers are that had already been existing prior to this exciting new addition to the MBS. So the +2, any one of those members don't necessarily need to be able to claim from MBS. So we've kind of said, yay, Allied Health is now part of the team that will get reimbursed for it, but that isn't part of the eligibility for actually undertaking a case conference. So like Kim said, the eligibility from who is in that team is actually really quite broad, and it ought to be in line with what the patient's needs actually are. So, all is said and done, that's really what it's all about, isn't it? That we give care excellence and that we really do start to strive towards better health outcomes for especially the vulnerable and chronic patients.
That nurse, that case conferencing or the care coordinator is that central person that these team members can say, look, we were going to have a case conference. Things have changed with this client. They're now in the hospital system, or I went and visited Betty and she was at home and I was doing her, podiatry visit or a physio visit. And, I don't think she's okay. I think we need to have a case conference earlier.
Every participant in the case conference needs to note down the date, the start time and the finish time of the case conference. So we'd really love you to not think of case conferencing as a one-off activity. Have a go and then don't worry about it. It really does need to become embedded in a very similar way to the way that GP management plans and team care arrangements are now mostly managed within practices as well.
Is their care suboptimal at the moment? Are you using your data to find out whether or not you've got good management?
Isn't it? This is where the rubber hits the road, and we really start thinking about, we've heard lots of stories now. We know what Medicare expects of us, and we know what the benefits are for the patient, and we know how great it is to collaborate with our peers and with the multidisciplinary care team. But where do we even start to practically do this within our practice? And that's really where the workflows come in, doesn't it, Kim?
It's about having a look at how we can make sure we have a good team dynamic, positive culture within an inclusive environment. And you can see that I really highlighted that we don't just have one person that's only deciding on all the ground rules. Ground rules are essential. Now, because we have people in the room doesn't mean we're a team. We need to make sure that all of those team members understand their roles. They understand that it's paramount that they bring their voice to the table if they are going to be part of this new service delivery.
And it's going to work best if you consider your own circumstance within your practice, what's going to work for your team, to determine which bits might need to be moved around. But it could look something like this. So we've done a lot of work in the lead up to this very first case conference. And so all of the systems will fall apart and it will not see longevity unless the billing is taken care of as well. The practitioners are obviously not going to be terribly appreciative if, for all of their hard work and input, there is no recognition shown at the end of that. So this is really, really important, as well as, of course, communicating the outcome of that case conference with your patient. Cheat sheet at the right there that gives you the time interval with the correct billing item number and the Medicare rebate that's current as of July 2021.
But
available.
Teach Back, again, allows that experiential learning, showing what you just understood the steps are. Can happen in wound care, something really, really simple as taking home a pulse oximeter during this pandemic.
That, quality improvement is a key requirement for the RACGP accreditation framework as well. Download the slides if you feel that that's going to be helpful to keep you on track with all of the tips and tricks that we've given you along the way.